Hi everyone, welcome back to What the Health is Going On. Now that we've dived into healthcare legislation in Kentucky, we can begin to look at national topics of health. If you don't remember, we've discussed policies about mental health, tobacco cessation, and the opioid crisis. And on the first episode, we discussed the biggest health issues in Kentucky: cancer, lung and heart disease, and obesity. This episode, we're going to take a look at the latest news nationally. Some things may be new, but we'll see some overlapping trends with the topics that we've already talked about. First, I want to start off with the DACA program and how it's related to healthcare. You might have heard about DACA on the news, or you might have never even heard about it at all. DACA stands for Deferred Action for Childhood Arrivals. It was put in place by former President Barack Obama in 2012, and it's helped nearly 1 million people who grew up as illegal immigrants in America. This act protects these people by keeping them from being deported and keeping them eligible for a work permit. And now we introduce why healthcare in America is horrible at times, unless you have insurance. But if you're considered an illegal immigrant, then you're not insured. And President Trump has recently introduced the idea of repealing DACA. He recently announced this year back in August. This could be a health crisis for the United States. These 800,000 people came into the U.S. undocumented as children. They're known as the Dreamer Group. Now, only 5 years later after this was passed, DACA is up for debate. This is a huge problem for healthcare since almost 1 million people living in the United States could become uninsured. Many are insured by employers and are able to have affordable insurance through DACA by being considered documented. Without it, these people are fighting to have quality healthcare. However, certain states across the U.S. are angry about the possible repeal. Because of the extreme backlash, President Trump tweeted and vowed to revisit the issue in 6 months. Listen to this news clip from CBS News that discusses how the nation reacted.
Hours after the president announced plans yesterday to scrap the DACA program, he tweeted that he may revisit the issue 6 months from now. Today, 15 states and Washington, D.C. filed a lawsuit challenging the president's action. They want to protect undocumented immigrants brought to the U.S. as children from deportation.
The problem here is insurance and coverage. Without it, people will suffer. We can relate this back to Kentucky since Kentucky has illegal immigrants, just like every other state. Looking at the states that sued the government over the DACA repeal, Kentucky is not one of them. This does not necessarily support whether current Governor Matt Bevin is for getting rid of DACA, but it definitely means he does not dread the idea since he did not take extreme action like the other states did. No matter what side of the political spectrum you're on, this is something to think about. The cost of healthcare would skyrocket everywhere since the amount of people uninsured in the United States will go up by 800,000 people. Moving on to the next trending topic, the same topic as I discussed last episode, I want to discuss the opioid crisis. Only a month ago, President Trump declared the opioid crisis as a national emergency. Listen to this news clip from NBC News on the president's statement of this rising problem.
To be a very decent man. Earlier, the president declaring war on the opioid epidemic.
I'm saying officially right now, it is an emergency. It's a national emergency. We're going to spend a lot of time, a lot of effort, and a lot of money on the opioid crisis.
Mr. Trump calling that crisis a serious and unprecedented problem, with opioids blamed for the deaths of nearly 100 Americans every day.
If you listen to that last part, you heard it right. Nearly 100 Americans die each day from heroin overdose. I'm giving full applaud to Donald Trump for giving this national attention. He said the government will be spending lots of money to fix this problem. And I'm glad we're spending money on this, because we need to. But this raises the question, where are we spending money and why? Do we spend money on trying to get other states on board with a needle exchange program? Do we continue spending money on Narcan to revive people who have overdosed? Do we spend money improving rehab programs? Where is the root of this problem and how do we make it stop? I'm very curious to see the president's response to these questions. And now you may ask, how does this relate to Kentucky? I'll tell you a story. I work as a traveling CNA for a nursing agency. I was traveling to see one of my patients that I provided for at her home. This patient didn't live in the best area of town, but it wasn't considered bad by any means. Until I got there one day, and there were police cars everywhere and an ambulance in front of her house. And someone mentions, as everyone's standing outside, that the neighbor's 14-year-old child has overdosed on heroin. This was in the city of Lexington, 15 minutes from campus, in a city where people bet on horses for fun and cheer on UK basketball like no other. And here, we also have a marginalized population that will grow up in the same drug-influenced culture and will grow up doing the same things everyone else around them did, because it was all they knew. President Trump helped them, help these families torn away by drugs, because like I mentioned last episode, heroin is now a drug of the upper class. It is everywhere. Okay, next topic. Do y'all remember a few years ago when there was that Ebola outbreak and we all freaked out about it because this disease literally made every orifice of your body bleed? And then when it calmed back down, we were all like, oh, thank God it's over. Okay, well, thank the CDC for that one. And if you don't know what the CDC is, it stands for Center for Disease Control and Prevention. It literally does what its name says. The CDC's mission is listed online as to work 24/7 to protect America from health, safety, and security threats, both foreign and in the United States. Whether disease starts at home or abroad, chronic or acute, curable or preventable, human error or deliberate attack, CDC fights disease and supports communities and citizens to do the same. Great. We have a program in the United States to protect us from horrible things like Ebola. But let's talk about the real importance of this. If you can reflect on some of the biggest epidemics of the world, like yellow fever, the Spanish flu, tuberculosis, the Black Plague, these diseases killed more people than some of the greatest wars have. But with programs like the CDC, we are protected since the mission of the CDC is to prevent epidemics like these. We live in a country where we are more scared of ISIS than germs. So maybe that's why President Trump decided to cut $1.2 billion from the CDC budget earlier this year, back in May. That is 17% of the original budget. Okay, back up. Remember when we were all terrified of Ebola, like I mentioned? That wasn't even bad compared to the monster epidemics of the past. The CDC is needed for this reason. By cutting away from the CDC, we are limiting our ability to combat foreign disease and homeborne disease. We're taking away our research centers to learn more about diseases. People that have Zika sometimes don't even know that they have it. The CDC were the ones who discovered Zika was linked to birth defects. This program is an asset to us and provides us with useful information and protection. We should let them keep their budget, honestly. Why are we taking away from it? Everything I just talked about will make a full circle back to Kentucky. This country is on an operating system together, along with the rest of the world. What happens the next state over will influence us. What happens in the past and the future will always come back to my old Kentucky home. I encourage all of you to form your own opinions and read the news daily. Don't just take it from me. Research everything I'm saying. But if you are interested in my opinion, I will be podcasting my own personal letter to the government about what I would do if I was in their shoes. Listen to my next episode to hear my own take on things. Until next time, I'm Maddie Miles, and thank you for listening to What the Health is Going On. Special thanks to NBC News, CBS News, the CDC website, The Hill News, and my amazing mentor, Dr. Sarah Kurtzmark. Stay tuned for my next episode.